98% of the kidney and liver transplant activity in our country is through live donation.
We have very less donors.
We have recipients in millions,
okay,
but we have donors in few hundreds. Okay. I would urge again all the viewers to please stop smoking.
Right.
If you still smoke, if you are aware of any friend, relative or anyone who smokes, please spare a few minutes and tell him the dangers of smoking. More importantly, if you are aware of anyone who does e-cigarette or vaping, please stop it. You will do a huge service to society.
Renowned thoracic surgeon, what message would you like to convey to the public about lung health and the importance of early detection of lung diseases?
Yeah, that's a very important question. So, last 20-30 years, we have always thought of heart as the organ which used to trouble us. Everybody used to think, oh, that patient has heart disease, you must prevent heart disease, eat less fat, eat less this, that, another. COVID changed the perception and brought lungs into picture. Today, we are faced with air pollution, which started from north, but today is a problem across the country. We have all kinds of viral infections in the air. We have increasing age of our population. We have lot of people who had from minimal to severe damage to their lungs during the COVID period, who are surviving but have some diseased lungs and who are slowly going down. So overall, there is a huge pool of chest disease sufferers in the country. And with the kind of air pollution problem which is there, my guess is that in the next 20 years, there's going to be an explosion of chest cases in the country. So it's very important for people to be aware of the factors which damage your lung. Everybody was aware of factors which damage heart. Everybody used to say, oh, don't eat fat, don't eat butter, this, that. Nobody knew about things. So smoking is still very prevalent. And I want to tell people that if you want to kill your lungs, go smoke. Because there is no non-smoker in India.
Right.
Males, females, from infants, newborns to elderly, anybody who breathes
smoking, passive
is smoking. And why do I say that? Because the air that we are breathing has chemicals, carcinogens, which are found in cigarette smoke. So even without actually taking a cigarette to your lips, just by the act of breathing, and mind you, we breathe 25,000 times a day. You, me, each one of us breathes 25,000 times a day, and children breathe much faster. A little toddler may be breathing 40,000 times a day. You are taking these cancer causing agents into your lungs 40,000 times a day. And it's damaging your lungs. So you are anyway a smoker. On top of that, if you add another quota of cigarette, imagine what you are doing to your lungs. Similarly, there's a new problem which is cropping up amongst especially our younger generation, Gen Z, and that's e-cigarettes.
Yes.
Vaping. You go to malls and you see these kids sitting in the malls and doing vaping. That hookah is there and it is circulated and everybody thinks it's cool. It's being projected as a cool alternative to smoking, which it's not. As a chest surgeon, let me tell you, e-cigarette smoke, hookah smoke, vaping smoke does as much damage to your lungs as cigarette bidi smoke does. Unfortunately, the general perception being created is it's a very safe alternative. I'm aware of parents who have encouraged their children to take to e-smoking so that they don't take to regular smoking. Arey sir, ye to safe hai. It's a myth. E-cigarette is not safe, it's as deadly as cigarette. Vaping is not safe, it's as deadly as cigarette. And I'm aware, I have cases with me where a 21-year-old boy vaped the whole night. And next afternoon, he was admitted to a hospital. And 2 weeks later, he presents to me in Vedanta, and I had to operate. Half of his lung had become like a balloon.
What is the fun in vaping? What like smoking you do? They say that you take tobacco.
Yeah.
But what is the fun in having vaping?
No, I must explain this. Why do people smoke? So when you smoke a cigarette, there is nicotine.
Right.
Right. Nicotine goes into our blood and passes the blood-brain barrier, goes and hits the brain.
Okay.
It's the best known stimulant. It
Okay.
gives you a feel-good factor. You take one fag and suddenly you feel like a king. So it gives you feel-good factor. But it is also the most addictive substance known.
Okay.
So you do get feel good factor, but your brain gets addicted and then it says, oh, I want more. So that's how you become addicted to smoking. Right? So addiction is to nicotine. But what happens is when that tobacco burns, apart from nicotine, there are more than 100 cancer causing agents which are also released, which go and damage your lungs. So it's a collateral damage happening because of these chemicals. Whereas you crave for nicotine, but the nicotine comes with these chemicals piggybacking on it. Right? This is what happens. So what these e-cigarette guys have done, and mind you, it's banned.
Yes, it's banned.
Government of India has banned e-cigarettes, vapes, but you go to malls and you'll find it freely available. It's a totally unregulated industry. So what happens is that e-cigarette will have a heater element. It will have a cartridge which will have an ether. So when you inhale, the ether comes in contact with the cartridge, which is a heater, and it converts into a vape, which you inhale and you exhale, and you get that feeling that you are smoking. Now, what these guys do is to add nicotine to it.
More nicotine to it.
And the more nicotine they add, the more kick it gives. And it's an unregulated industry. There are no standards. You may add 1 kilogram, somebody adds 10 kilogram. The more you add, the more the kids will like it, the more that brand will sell. And then just like we have these whoosh tragedies where some poison come, or we had this cough syrup tragedy. So like that, this ether may get some impurities. And if it's toxic, it's going directly into your lung. If you eat something poisonous, it goes into your intestine. Intestine is very tough. It can still save. Lungs are very soft. So some chemical goes into your lungs, next day your lungs go patak and you are on ventilator. I'm aware of people who have vaped the whole night and next day they were on ventilator. People have died. People have gone to the stage of requiring lung transplant. Let me summarize by giving a one-line message. E-cigarette vaping is as damaging as cigarette or bidi, if not more damaging. Data is yet to come. So please spread this message across the society that e-cigarette and vaping is deadly. It's not safe. Don't let your children take to this habit. And if you're aware of anyone, please stop it. Please stop it.
Okay, sir. How can India improve its lung transplantation program, and what are the challenges faced by patients and medical professionals in this regard?
So lung transplant is different from kidney and liver transplant in the sense that 98% of the kidney and liver transplant activity in our country is through live donation, where the relatives of the patient donate the organ, and that's how transplant is done. Unlike that, in lung, this cannot happen because if you donate one lung, the donor's life gets affected. So, and the basic principle of donation, organ donation, is that the donor should not be put to harm. So therefore, there is no live related activity in lung. It can only happen from dead donors. So there is an entity called brain dead heart beating donors, where the family consents to give the lungs, and that's how you get the lungs and you transplant the lungs. Unfortunately, this activity is negligible in our country. There are millions of people who are dying every day. Many of them are brain dead, heart beating donors, but the awareness that you can give the gift of organs to person, and mind you, one dead person can benefit 7 people. You can give one heart, you can give 2 lungs, 1 kidney, 1 liver, 2 kidneys, intestines, pancreas, bones, joints, skin, cornea. I mean, you can benefit so many people from one organ, and these organs anyway are going to be burnt. So if you put them to good use, somebody will live because you had this gift. But the awareness is still very low. People don't consent. So the biggest problem facing lung transplant in India is shortage of donors.
We have very less donors.
We have recipients in millions,
Okay,
but we have donors in few hundreds.
Okay.
So there's a huge gap. So most of our patients who are waiting for lung transplant,
Right.
unfortunately, they die while on the waiting list, while they are waiting for an organ to come.
Oh, can you tell us about the Medanta Robotic Institute mission and goals, particularly in the field of thoracic surgery?
Yeah. So we started this institute in December of 2020 as an apex state-of-the-art institute which would do three things in the field of thoracic surgery. We aim to provide cutting-edge clinical care to our patients who need surgery. Number one aim. We wish to train more and more young surgeons from across the country in the art and science of thoracic surgery. So we have a training program where we take 3 surgeons from across the country through an all India exam, and we train them to become thoracic surgeons, because there is a huge shortage of thoracic surgeons across the country. And third, but equally important goal, is to do research on our patients who are admitted, to tell people how to do best care, as well as community research in the allied fields. So patient care, teaching, research. So it's an institute established with these trinity of purpose, and we are passionately carrying it out.
Okay, how does the institute stay at the forefront of innovation and technology in robotic surgery?
By remaining awake 24/7 and working hard.
Okay. What kind of training and education program does the institute offer for medical professionals looking to learn robotic surgery techniques?
So we have a board certified training program where people can come in after an exam which is conducted by the National Board of Examinations. So we have 3 seats allotted every year. So these boys and girls come from across the country, stay with us for 3 years, during which they learn the art and science of thoracic surgery.
Okay. What drives your passion for thoracic surgery and lung transplantation, and what do you find most rewarding about your work?
That's a very philosophical question, and I would say that I would quote Steve Jobs' famous statement that you must do what you love, and you must love what you do. Unless you are in love with your job, unless you are passionate about your job, excellence will not emerge. Excellence is not an accident. Excellence emerges when there is passion, there is drive, there is hard work, and more importantly, there is a fire which is burning inside you and which is burning you. It's burning inside you and it's burning you. When you're burning in that fire to do something, that's when you become gold and you come out as a gold winner.
Okay, how do you balance the demands of being a leading surgeon and researcher with your personal life?
Have a less demanding wife and you have all the time for your work.
Okay. What advice would you give to young surgeons looking to pursue a career in thoracic surgery or robotic surgery?
So I would say that India is at a stage where we need hundreds and hundreds of thoracic surgeons. We are still struggling with the old world diseases like tuberculosis and its after effects. Even if India was to eradicate tuberculosis today, whatever millions of cases have had tuberculosis, for the next 30 years, they would continue to have what I call post-tubercular complications. They'll continue to come for next 30 years with the complications of the tuberculosis there. That is even if we eradicate today. So there will be a lot of infectious disease. On top of that, because of pollution and various factors, we have a lot of cancers which is coming. So this is a third world disease which is still there, and the new world disease which is coming. So we have worst of both the worlds. So there is going to be a huge volume of chest cases in the country, and there are very few dedicated thoracic surgeons. So it's a field where if people enter, of course, it's a very demanding field. Margin for error is negligible. It's a lot of hard work, but at the end, there is a huge amount of professional satisfaction.
Thank you, Dr. Arvind Kumar. It was a pleasure talking to you.
Thank you so much, and I again wish all the best to all our viewers who have spent their precious time listening to our conversation. Thank you so much.
Thank you once again, Dr. Arvind Kumar.